Well, the main objective of the registry was to test the safety and efficacy of iVolution Pro as a stent for the FEM populations. So what we did was to enroll 182 patients in Latin America, involving many centers, with a clear inclusion and exclusion criteria. Many of those lesions, high rate of those lesions were moderate to severe calcified lesions, and a high rate of the patients present with CTO. Good things of the registry were that more than 50% of the patients were in CLI, so we are not talking about just claudican patients, but most of them were in critical limb ischemia, showing us that the enrolled population was a complex, multi-level, multi-vessel arterial disease with relatively calcified lesions and with CTO, long CTOs compared to stenosis. In fact, again, more than 50% of the population present lesions task C and D. First of all, the result of the registry, of the complete registry, were so nice, because what we saw was that iVolution Pro allow us to obtain a high rate of primary patency at 2 years and a high rate of freedom from TLR. So stent maintained patent for 2 years in high percentage, and there was no need for reinterventions. This was in the femoral popliteal segment, and when we did the sub-analysis of flexion population, so the stent deployed in popliteal, only in popliteal artery between P1 and P3, we discovered that the stent performed even pretty well and so good in flexion area, because it gave us again high rate of primary patency at 2 years and high rate of freedom from clinically driven TLR, so no need for interventions. Well, the aspect of the product that allow us to say that we can treat popliteal artery, the first thing to underline is that the results of the trial or the registry allow us to say we can try popliteal artery. Specifically about the product, this is a last generation standard self-expandable nitinol stent. Again, the result without fractures allow us to say that it's a good stent, a good option to treat popliteal artery. For sure, the stent was tested most of the cases after endoluminal crossing, and as I said, in moderate to severe calcified lesions. So with this result, we can conclude that iVolution Pro represents a good option to treat flexion points like popliteal area in CLI patients. The most important thing after crossing is the vessel preparation, and all the congresses we are pushing to match about the vessel preparation concept, and this is very, very important for the use even to iVolution Pro. We must to gain lumen as much as possible, to deploy the stent in the proper way, to avoid any type of compressions under the calcified plaques, or even if we cross subintimal, to avoid torsion and situations that could make the stent more prone to fractures. So vessel preparation is the must before stenting.